Hello guys, welcome back to the channel. It's Unit 2 Part B. Family Planning Program. This is a program which is introduced into our community so that we can practice the control of number of children in a family and to provide the interval between the childbirth. From first child to second child, the gap should be at least 2 years. This method is practiced with the help of contraception and voluntary sterilization. According to WHO, we do have a definition that is the ability of individual and couple to anticipate and attain their desired number of children and the spacing and timing of their birth. The definition might be different, but the meaning is same. That is to control the number of children in a family, and we need to provide time for each birth. Next, we have a family planning method. In family planning method, we have two branches, temporary method and permanent method. In temporary method, for a particular time, the couple can have a sexual intercourse, but still they can't attain the pregnancy condition. That is temporary method. And in permanent method, when the permanent method of family planning is performed, after that, even if the couple is involved in the sexual activities, the chance of getting pregnant is very less. Like in 100, only 1% or 2% of chance of getting pregnant is seen. Only when the technique is failed, at that time the woman gets pregnant. This is temporary and permanent. In temporary, we have 5 types: natural, biological, chemical, mechanical, hormonal. While in permanent, we have 2 types. One is for female sterilization, other is for male sterilization. There are few important terms in the family planning program. Let's know it. Like family limitation. Here we are controlling the number of child. It's not involved like spacing, interval and all. Here we are controlling the number of child with the help of birth control method. And this method will be only practiced when it is safe to be used and there is no side effects seen in these conditions. Like condoms will be used, and IUDs, rings. This doesn't have any kind of big side effects. It is safe to be used, and it will be encouraged to use. And next we have eligible couple. Eligible couple or those couples who are married and the woman one who is present as in this couple is in the reproductive age, that is in childbearing age. They are known as eligible couple. Next, target couple. What is target couple? First of all, for which couple we can advise about the family planning method. You can't just advise a school going girl about the family planning method. You have to see which kind of couple to be advised. Like the couple one who has 2 or 3 children already, and for that couples you can advise about the family planning method to limit the number of children. But you know what, nowadays if the couple has 1 child or even newly married couple is also being advised about the family planning service. Next we have cafeteria choice or cafeteria approach, and this is the rights of choice. Like the family planning program will be followed, but we have to give choice to that couple, to that individual, to which method to be followed. You can't say we have only this method, you have to follow this method only for the family planning purpose. No, you have to provide all the choices, like biological method, hormonal method, mechanical method. Even it's not temporary, permanent methods what are available, we have to provide the choices for them. In which method they are comfortable, they have to choose their own method. You can't implement your own. That is cafeteria choice. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.